Welcome back. The FDA and CDC authorized booster shots for billions and millions of Americans, but not everyone just yet. To talk about the booster shot and some tips if you're getting ready for that third shot, we're bringing our 9Health expert, Dr. Payal Kohli. Dr. Kohli, good morning. Thanks for joining me.
Good morning, Natasha.
So my first question, who can get that booster shot right now?
This is very confusing because we've had a lot of back and forth on this. So if you're immunocompromised, you can get it regardless of which brand you got in the first place. If you're not immunocompromised, only Pfizer recipients are eligible for the booster if they're over the age of 65, if they're 50 to 65 with chronic health problems. If you're under 50 or you're a frontline healthcare worker, it's a little bit more of a gray zone, but you're probably also eligible.
So yeah, it just sounds like there's a lot of restrictions still with that in categories. How long do you have to wait after your second shot to get the booster?
This is an important question because we're actually finding from the data that if you get it too soon after your second shot, it's not as effective. So the sweet spot appears to be about 6 months, but really the science is telling us the longer you wait after that second shot, up to about 8 or 9 months, the more efficacy you're going to get from that booster, the more of a boost you're going to get.
Okay, and you kind of mentioned this in the first question, first answer. Can you mix and match brands? For instance, if you got Moderna for your second shot, can you get Pfizer then for the booster?
You know, I've been asking this question myself because I got Moderna. I'm still waiting for my booster. And the advisory committee to the CDC actually looked at all the data on this. So we don't have a ton of science to guide us. So the formal recommendation is no. But what we've seen coming out of Europe and what we hope to do in the next year, because we don't want to commit somebody necessarily to one brand, because that's not the most effective public health strategy, is to try to mix and match. So at this point, no, stick in the same family that you got. But next year, even if you got a Pfizer, you might be getting a Moderna or vice versa.
Okay. And you know, it is flu season after all. A lot of people getting sick this time of year as well. Can you get your flu shot and your COVID booster shot at the same time?
So the theoretical concern with getting two vaccines together is that you activate your immune system to try to fight both viruses together and you're distracting it. Also, potentially the side effects can get amplified. But the good news here is that you can probably get your Pfizer or Moderna booster as well as your flu shot on the same day. One of my friends said one arm for this one, one arm for this one, and then he compared which one hurt more.
Was more sore, yeah.
Exactly.
Speaking of soreness, have there been any severely adverse reactions to the Pfizer COVID shot?
An important question, because the more vaccines you get, the more you activate the immune system. But thankfully, we're not seeing a ton of adverse reactions. We're seeing about 5% of patients have lymphadenopathy, which means a swollen lymph node on that side, in the armpit, on the side that you got the injection. A lot of people are having the same sort of side effects that they were having with the first or second fevers and feeling achy for a day. But the good news, and a lot of people worry that the third one's going to be really bad, a lot of people are not feeling anything at all.
Yeah. I got my booster shot because of my cancer history, and I had no major side effects.
Didn't feel anything at all?
I was just really sore, but other than that, I was fine. It was completely safe to get.
Yeah, absolutely.
All right, Dr. Kohli, thank you so much.